Hi class. So this video is going to be on teaching you how to draw up medication from a vial into a different kind of syringes. Okay, so first I want to show you what we have here. So we have some sterile sodium chloride, 0.9% for injection. We often use this for mixing of medications or to, in our case, practice giving medications or drawing them up. Okay, you always want to make sure that you do check your expiration date and that it is not expired. Okay, when you see that there is a plastic stopper on the top, you know that it is a new vial and it is sterile, used for one time. Okay, so I'm going to set that to the side. I'm going to show you what I have here on hand right now. Here I have a 1 ml TB syringe with a slip tip needle. The needle is fairly small, 25 gauge, 5/8 of an inch. I also have here a larger syringe, and this is a 3 ml syringe with a lure lock tip, which I'm going to show you how to use. A much larger needle. This is a 22 gauge, and it is 1 and 1.5 inches long. Okay, they both are sterile. I also have two different needles here for use. We have a 18-inch by 1.5, and here we have a 21 gauge by 1 inch. Okay, so depending what you have at your practices, some offices have their syringes without needles separate, and then they have their needles separate. Some order their equipment together like this. It just depends where you work. Okay, so I'm going to show you how to first open up the syringe here. So we're going to start with the slip tip. Okay, it is a sterile package, so if you did want to put it onto a sterile field, all you would have to do is pull it open. Let me adjust this a little bit so you can see a little bit more of what I'm doing. Just peel it away, okay? And then you would just kind of toss it onto your field, okay? And then just toss that. The cap is on, but even though we see the cap is on, you still really need to push that on there because this in fact is a slip tip, meaning that if you go to pull it off, it just comes off. So you see how there's no ridges? Okay, it just slips on. So when I put it on, I really push, okay, because I don't want that tip to accidentally come off. So the cap is on, so I'm going to set this down for a second because I'm going to show you how to open the vial. With these rubber stoppers with the lid, all you're going to do is just get your little thumb and push off. You heard that clip? That means it is the first time opening it. If you notice here, it has the rubber stopper. It has like a little target in the center. So for the first draw, you do not need to cleanse the top of the vial because it is sterile. If you accidentally touch it, yes, you do need to cleanse it with the alcohol wipe. Okay, so then we're going to carefully take off the cap. So when you take off the cap, you want to do a fluid pull motion, okay? Either this way or this way. You don't want to do it like too close to the point where you accidentally ricochet back, because if you do that, you risk puncturing yourself. So what I like to do with a slip tip is I hold the hub with either my nail or both my fingers and hold the cap nice and tight, and in one fluid motion I'm going to take the cap off. Okay, so I'm holding tight on both ends. 1, 2, 3, pull. Oop, I hit my vial, but that's okay because the needle is still sterile. So I'm going to carefully set my cap down. Okay, I'm going to grab my vial. I'm going to hold the vial down. And before I do that, I'm kind of going to mess here with the plunger, get nice and loose because sometimes they're a little stiff. I'm going to get the vial and then I'm going to hit it right in the center of that target. And I'm going to push that needle all the way in. Okay. Then I'm going to invert. And you're going to pull the desired dose. Okay, so for us, we're going to put, I'm just gonna put 0.3 so you can see the liquid coming in. Okay, so there's the 0.2, so right where the end of the stopper is. And if you see, there's bubbles in there, okay? So, and we want those bubbles out. So I'm gonna kind of push in again slowly, and I'm gonna try to draw in again, hopefully with no bubbles. I'm gonna go to the 2. I'm going to take this out, set it down. I'm gonna push this up so you can see what I'm doing. Staying away from the tip of the needle, I'm going to hit it with my finger, okay, to see if I can get that bubble to come out. And it sure did. Okay, so no bubble there. If you accidentally see a little fluid on the needle, like so, watch, let me push a little bit out so you can see what I'm talking about. See that? Don't touch it with your finger. Just again, flick it and it comes off. Flick it again, there we go. Okay, and we're still at about 0.2. And you wanna make sure that your dose is all the way through the hub down to your calibration. Okay, make sure this is on. Now I'm going to recap. Okay, so if you're a first timer, you want to do it very carefully. Okay, you want to bring it down. You don't want to do this in the air, and very carefully bring it together. Okay, and you want to hear a click. Did you hear that click? If you didn't hear that click, it's not closed. Once you're more experienced, you can, of course, you know, put the caps on higher up or more in front of you. But when you're first starting, you have to be very careful not to prick yourself. Okay, so now we have our syringe is full at 0.2. Okay, so I'm gonna put this medication back in. In our case, it's just saline. So again, you're gonna hold the hub and pull it. And this is all for demo purposes. This is not going to be used on a patient because I want to show you how to do something else. Ready? 1, 2, 3, pull. But oh, we need to sanitize this, right? Okay, so let's put the cap back on. Nice and easy does it. Okay. And we want to hear that click. Okay. I'm going to grab my cotton wipe here. Set it on top and clean it off. Let that dry for a second. Alcohol dries very quickly. Okay. So 1, 2, 3. That time was a little harder. So let's say I want more fluid in this. So what I'm going to do, since it's now clean, I'm going to right in the center push in, push my medication in. Okay, I'm gonna take my needle out. Okay, and I still have my alcohol wipe here. I'm gonna wipe it again because I'm gonna go in again. So set that to the side. So what you can do is also, let's say this time I wanna fill it to 0.3. So I'm gonna fill my syringe with 0.3 of air. I'm trying to get that last little bit out. 0.3 of air, right there, okay, 0.3 of air. So I'm gonna get my vial, hold it, go in, invert, hold the vial nice and tight, push that air in, okay, and I'm gonna slowly draw so I can get to 0.3. Little past 0.3, that's okay. Push it up to your calibration, 0.3. Good. Check to see if you have any bubbles. I don't at the moment, but I'm gonna come off the vial just to make sure. Okay. Check. Hit it a couple, hold tight without touching the needle. Make sure no bubbles. Perfect, no bubbles. Get my cap and slowly come in and cap. Listen for that click. Good, now it's tight. Now, what if I went to recap and I accidentally touched my finger, touched the napkin, touched the outside of the cap? No problem, just into the sharps, discard, and start over. Okay, so that is loading a TB syringe with a slip tip.